All right, June marks National Migraine and Headache Awareness Month. So today we are getting a breakdown of 10 natural ways to combat those severe headaches.
Dr. Sina Smith joins us now with more, and welcome. Thank you for being here.
Thank you so much for having me, Amy and Tana.
And your natural ways have worked so well. You were able to get rid of your own headache today.
Yes, I have suffered with migraines for many years, but because of all the kinds of work that I do, I really have gotten to the point where I have one very, very rarely.
Okay.
And so this morning, I woke up with one. I haven't had one in about 3 or 4 months, but I woke up with one. And I did some gua sha for myself, which we're going to talk about in just a second. That's a scraping technique. And I just kind of worked on the epicenter of the migraine right here. Gua is the practice of scraping, and then the sha is this red kind of petechiae, these little hickey marks that come up on the back of your neck.
Okay.
And then I took some magnesium. I took some homeopathics, a Tramiel, and then the migraine was gone in about 30 minutes.
That is
Wow.
awesome.
Wow.
Let's talk about your practice. You kind of combine Western and Eastern medicine to help combat migraines and headaches. But first of all, let's start off. What's the difference between a headache and a migraine?
Excellent question. A lot of people feel like a severe headache is a migraine. And for a medical diagnosis, it's a very specific thing. It's a one-sided headache. And so it's not a headache that goes all the way across the front of the face. It's not a headache that's necessarily just behind your eyes. It's not something that's coming from the back of the neck. It's really a throbbing, one-sided headache. And it takes a medical provider to make that diagnosis if you're having migraines.
Okay, and so you've got a number of natural modalities that actually, and you've already done acupuncture on me. And so what is this doing?
So this particular spot right here is known as the command point of the head and face. And so it's one of the best points for treating headaches of all kinds. And I recommend to my patients that they massage that place with their thumb and just give themselves a little pressure point. And you can do it even if the headache is on the right side, you can do it on the right hand or on the left hand. And it's a wonderful place to just kind of help to control that headache and get the chi, we call it, to go down on your body.
So the fact that you mentioned needles probably puts a lot of people on edge. But I'm going to let you do one on my hand here to show how simple it is and how much it does not hurt.
Yeah,
because both of us have actually done acupuncture at different points. I actually did it for fertility for years in hopes of increasing my fertility. But it can be used for many different things, right?
Absolutely. It's a whole body system of medicine. And so it treats all of you. So headaches in Western medicine would be a diagnosis. In Chinese medicine, we would think about headaches, difficulty sleeping, menstrual irregularities or difficulties getting pregnant, digestive problems, etc., all the problems that you're having, and look at that as a root cause. And so we're treating the root, which means all the rest of these things start to get better.
Okay. So we can.
And you can see the size of this needle is very, very small. And I'm just going to tap that in.
That's it.
That was it.
And you really don't feel much of anything at all. It's about the size of the hair on your head.
It is.
Okay,
and
so
I really don't feel it.
Yeah, you don't feel it at all, especially I kind of ignored mine now too. So what are some of the other other things, natural things that we could be doing?
Something else that is really, really important for migraines is magnesium. And the dose from the RDA about how much magnesium we should get into our systems is somewhere between 300 and 350 milligrams a day. What I find in most of my patients, and especially my women patients who are menstruating, is they're losing some of that magnesium as they're menstruating. The food that we eat is not so rich in magnesium, and so they tend to be a little bit lower. And so for myself and for my patients, I recommend magnesium. And a lot of people don't really understand that there's a lot of subtlety between the kinds of things that magnesium is bound to as a salt to get into your system. So we can have magnesium chelate, we can have magnesium citrate, we can have magnesium oxide and hydroxide. The latter two are in milk of magnesia.
Yeah.
And so they don't really get into the bloodstream very well. They stay in the digestive system to help you
Flush out.
Exactly. Release. Exactly. Clean things out. Magnesium threonate is a kind of magnesium salt that has the highest amount that gets into the blood-brain barrier. And so for folks that have headaches, magnesium threonate is a really good magnesium salt to use. And I find it one of the most effective for treating migraines.
But you have to be careful because if you use too much, it can have a negative side effect.
Exactly, exactly. Not only can you have digestive releasing symptoms, but also magnesium is important for contraction of any kind of muscle, and the heart is a muscle.
Yep.
And so we don't want to cause arrhythmias in our heart because we're taking too much magnesium. So it's really important to have a conversation with a trained clinician who can advise you about exactly how much magnesium and the type of magnesium that you're taking.
There are so many good tips out there too. Thank you so much. Dr. Sina Smith, SinaSmithMD.com is her website. She's got a book too. Check it out. Kind of manage those headaches so you don't have to keep taking the drugs, going in for the Botox, all the things that help stop it too.
Absolutely. We don't have to suffer.
Right.
That's the
Thank you.
message.
Yeah.
All
Thank
right,
you so
thank you.
much.
Thank you for having me.